Hi, this is the first video in Module 2, this course, calling it Data Science Basics. Just as a really quick overview, we're going to go over the types of data, what we can do with the data, and the next video we'll go over data quality and data transformation. Should be pretty short. So let's get started. Types, roles of data. First, actually most important, data sources. Where can we get clinical data from? We can get clinical data from like EHR data, so like Epic, Cerner, places like that. Another really popular place to get data is claims data. The cool part about claims data is that you're more likely to get care that was actually delivered because it's clinicians who are submitting for billing to insurance and Medicare and stuff like that. So then you can see whether or not they actually filled the prescription because they actually went to the pharmacy. As opposed to EHR data, you're getting a lot of inpatient stuff. There are some, obviously EHRs for outpatient data, but whether or not they get data on things like whether a prescription was filled or something like that. So there's also public health data like CDC and HANES, which gathers data on public health related things from health departments. Like sometimes the hospitals and physicians are required to do mandatory reporting for certain, communicable diseases. COVID was a really big example of that. There's patient-generated data, so things like wearables, places from social media, if you want to look into like sentiment on how people feel about things. And then data generated from research. So if you're running a clinical trial, you're running some sort of, prospective, retrospective sort of trial design, you can go define what kind of data you want to gather it yourself, work with, research coordinators, all those things. And there's also like health surveys and biobanks. So things like in the United States, the NIH, we have All of Us research program, which, is actively gathering data like this. My face is blocking this, but UK Biobank is another really big one. So case in point, there's lots of different places where you can get two main parts, types of data, structured and unstructured. Structured, you're thinking like an Excel sheet, like you have a bunch of rows, a bunch of columns, and you follow a consistent schema and format. So then everything that's going to be inside one column should, in theory, all be of the same type. So then like if we're recording blood glucose, for example, we're not doing good, bad, 0.01, 2, milligrams per deciliter. It should all be, in the same format, all numerical, hopefully using like the same measurements, but you can sort of tinker around that as long as you record what schema it is you're using. The benefits of this, very easily searchable. You can query it using databases, things like that. Very digestible, very analyzable. This is the kind of stuff, the bread and butter. Public health research, clinical research, things like that. You'll find this in like with EHR data. So recording things like this patient had this condition assigned to them on this date at this time. This patient was given this medication at this dose through this route of administration at this date at this time at this location by this provider. It'll record things like lab test results, like I just said, prescriptions, medication administration, vital signs. Their heart rate was, this patient's heart rate was this at this time. ICD codes for diagnosis. Like at this point during this encounter, we diagnosed them with heart failure, with hypertension, what have you. Pretty straightforward. As long as everybody uses the same schema or a similar schema, it's really easy to just move the data back and forth. As long as it's relatively similar, like you can just putz around with it and make it work. It's limited somehow by the categories that you make. So if you make, a column where there's a lot of nuance involved, like there's 10,000 different values that could take on. Like if you just have a column that just says diagnosis, there's tens of thousands of different diagnoses that there could be in that column. How useful is that to your research purpose? And then there's nuance that's missed. So when perhaps you as a clinician or that you've seen, you write patient narratives describing the visit, describing how the patient appeared, looked, what their concerns were. Difficult sometimes to put inside of a box that's neat. So then you miss a little bit of nuance, and by definition, you have to oversimplify things so that they can fit into those sort of predefined formats. Unstructured data, obviously, it lacks predefined format. It's things like narratives, patient notes, raw lab data, imaging, recordings from a patient encounter, things like that. So then this requires additional pre-processing before you can really analyze it at scale, but it contains richer details, perhaps more details. So like I said, it also includes things like genetic sequencing data, path reports, so things like that. And then you require like computer vision and natural language processing. My face is covering it, but you can sort of imagine the sorts of things that get lost. So then what can we do with it once we have the data, and why? So, for one, there's population health. So, studying how healthy is our current population. Do a lot of people have diabetes? Are more people getting diabetes? That's a problem. And perhaps gain insights on how we can solve it. Clinical research, like I said before, prospectively saying, I want to gather this sort of information on these sets of patients. I'm going to follow them for X amount of time, see different outcomes that come as a result of some intervention or some sort of thing that we're observing. Clinical decision support, we can take the data of things that we've done to, thousands, millions of patients in the past, see, patients that had all of these characteristics, had this heart rate, had this temperature, had been in the hospital for X amount of time, had these such and such comorbidities, they had a X% chance of developing sepsis. So that, you might have seen this if you've been practicing or heard about it, or it makes sense to you. Like in an EHR, if a clinician is looking at their computer, the patient pops up, you get a little pop-up box that says, hey, maybe your patient might get sepsis. You should do something about it. Trying to catch things before they happen, use the wealth of data to see if we can predict things that happen or at least offer some clinical decision-making support. And we could also look for quality improvement, operational improvement. What percent of patients in our hospital on this particular floor are getting the appropriate, like state mandated or insurance mandated care so that we get reimbursed fully. Different people practice medicine a little bit differently. There are, information sort of gets disseminated, but as a healthcare organization, if you want to make sure that every single, for example, heart failure patient gets an ACE inhibitor for sure on discharge, you can use the data to go back and look who's not doing it, why aren't they doing it. Perhaps there is a good reason, but you can't know if you don't look and if you don't find out. Operational improvement, things like, how quickly do patients move from the PACU back down to a floor? How quickly can you clear out an OR? You can really only improve on these things or see where there are issues in that if you record the data, look at it, and analyze it properly. And then patient engagement, things like, how can we use data to make sure that patients arrive to their appointments on time? What can we do to ensure that patients have a good experience and are happy with their experience and get, good quality care? Like what metrics can we do? Can we use to measure that? Can we do patient surveys to see how like good bedside mannerisms certain clinicians have? And then see how we can improve it and, maybe poke them like, hey, maybe don't be rude to your patients, things like that. So lots of different ways to use data. And how can we achieve these goals? Well, we can do descriptive analytics like the table 1 over there, just describe your patient population. We can do statistical models. We can do predictive models. There's a little bit of difference between the two. The idea being the statistical model is used to, well, they're all statistical, but the point is, are you trying to describe something about your patient population, or are you trying to predict what other patients might do based on that? Sometimes you can do both, but it helps in terms of research design, and it helps in terms of how you run your study and what models you use and how you describe the output of your models to know what is the goal. Are you trying to describe this is what's already happened with this population and draw inferences from that? Or are you saying the associations don't really matter too much to me, although perhaps they should for explanation purposes. But what I'm really interested in is seeing how can I apply this in the future as a prediction model. So those are some ways that we can go about using the data. And the next section we'll talk about different issues with data and things that we could do to the data, and how to think through that with like a clinical sense.